I don't want therapy. I'm not the problem. I don't know why no one will listen to me.
I've been in therapy before, and it was such a waste of time. I can't believe people pay for that stuff.
I think my wife could really use some help. She seems so unhappy. I'm afraid to talk with her about it because I don't want to make it worse. She's so hard on herself.
My son doesn't talk about anything. He just looks at his phone or goes into his room. Sometimes he gets so mad, but he shuts me out when I talk about getting support.
These are the voices of people who are reluctant to getting mental health treatment, and the voices of people who care about them. If someone you care about is struggling with stress, mood problems, relationship challenges, or a mental health disorder and has not yet talked to a doctor, the most important thing you can do is talk with them about what treatment means, what kind of treatment might help, and how to obtain it. Keep in mind a few simple ideas. Support does not equal control. If someone is resisting the idea of treatment, it's important that you listen and try to understand their concerns. People's perspectives, culture, personal history, and their own ideas about solutions to problems may impact the way they think about getting help, as well as what kind of help they want and who they want assistance from. For some people, connecting with a clergy member or spiritual advisor, joining a support group, or seeking help from family members may be more acceptable than first approaching a professional. There is no one-size-fits-all. It's important to understand the different types of mental health treatments that are available and to ask questions to learn about which options might be useful. Some treatments, such as meeting with a counselor or therapist, involve scheduled sessions either in person or over the phone. It's important to review information provided by healthcare professionals and to understand the different treatment options that are available. Mental health issues are common. It's common for people to be concerned about what other people might think. There is often a fear of being looked down on or discriminated against. But mental health issues are common, and discussing types of treatments positively and without judgment can make seeking help seem less embarrassing or shameful. Be aware of barriers. Some people want treatment, but experience barriers to getting treatment set up. Difficulty finding a qualified treatment provider, lack of health insurance coverage, financial problems, and cultural consideration can prevent a person from engaging in treatment. As a caregiver, take the time to help your loved one deal with these barriers. Go over insurance with them, help set up appointments, and help them to find solutions to any question they may have about treatments. If someone is in crisis, they don't have to agree to getting help. If people are considering hurting themselves or others, if they are unable to care for themselves, or if they are thinking or talking about suicide, it's important to help connect them with treatment, even if they don't want it. If there is a crisis, call 911 for emergency help. The National Suicide Prevention Lifeline at 1-800-273-7255 TALK is always available, and you can talk to a trained crisis counselor 24/7. Privacy concerns. Some people don't seek mental health treatment because they are concerned about privacy. Remember, mental health professionals are required by law to keep all information, paperwork, and records confidential. Everything people say to their providers is private, except in an emergency situation. Even in an emergency, the provider will only provide enough information for the patient to get the appropriate help. What is discussed in a therapy office stays in a therapy office. Consultations, second opinions, and choices are encouraged. Just like with a treatment for a physical health issue, people can seek second opinions and consider different options. Not every provider has the same specialty or skill set. Finding the right match is one of the most important parts of connecting with any type of mental health treatment. Engaging a loved one in conversations about mental health care can be tough. People experiencing symptoms might be guarded, defensive, upset, or may resist suggestions that they associate with being forced to seek treatment. But the good news is that these conversations are common, and there are different ways to discuss what treatments can look like. Have the confidence to talk about it. This might be the most important conversation a person ever has.